Since the early days of the pandemic, one question has lingered. To what extent do psychological factors, like fear and suggestion, affect the symptoms people experience after COVID-19? Some have argued that long COVID might be partly driven by the nocebo effect, where negative expectations and media exposure lead to real physical symptoms. But does the evidence support that idea? A recent study from the Netherlands set out to explore that question by comparing two things: the actual symptoms reported by thousands of people in the general population after COVID-19, and the types of symptoms most commonly mentioned in Dutch news articles about long COVID. The researchers used data from the Lifeline's COVID-19 cohort, which tracked over 4,000 people who had COVID-19 and compared their symptoms to a matched control group of over 8,000 people who didn't get infected. They focused on the period 90 to 150 days after infection, a window where persistent symptoms typically emerge. At the same time, they analyzed 1,266 Dutch news articles published during the same time period. These articles were coded for mentions of 23 different symptoms linked to post-COVID conditions. So, what did they find? The key insight: the symptoms most frequently reported by patients were not the ones most frequently mentioned in the media. For example, the most common persistent symptom in real patients was loss of smell or taste, ageusia, anosmia, seen in 7.6% of people who had COVID-19. But this symptom was mentioned in just 6.3% of news articles. Meanwhile, general tiredness, which was reported by only 4.9% of patients, was the most commonly mentioned symptom in the media, appearing in nearly 24% of articles. Some symptoms that clearly increased after COVID, like tingling limbs or heavy arms and legs, were barely mentioned at all in the media. If media exposure were the main driver of long COVID symptoms, we'd expect people to report what they see most often in the news. But that's not what the data shows. In fact, there was no clear pattern connecting media coverage with symptom prevalence in the real world. What does this mean for the nocebo theory? The nocebo effect is real. It can affect how people perceive symptoms and respond to illness. But this study suggests that media-induced nocebo effects do not explain the core symptoms of long COVID. The disconnect between what's in the news and what people actually experience points to a biological basis for many long COVID symptoms. That's important because blaming symptoms on psychological factors alone can lead to stigmatization. People with long COVID are already told, "It's just in your head," far too often. This study argues that such assumptions aren't just wrong. They may delay diagnosis, reduce empathy, and harm patient care. The takeaway: long COVID is complex. And yes, psychological and social factors might shape how symptoms are interpreted, but the actual patterns of persistent symptoms are not explained by media coverage. We need to continue investigating the biological, psychological, and social roots of long COVID, but always with care and without assuming symptoms are imagined. The real message? Just because something is widely reported doesn't mean it's what people are actually living with.